One of the first things that we sort of talk about, or things some of you might have already brought to this process, is you're going to have some kind of research question or topic area that you're interested in looking at. And one of the things that you probably did is you got this question from patient-centered questions that you've seen in routine clinical practice, right? So stuff you've seen on the ground, issues you've seen. It could be new treatments to diagnostic tests. Are they better than what we had before? Interventions and the patient experience. Is the doctor communicating well? Are they not? Do we need better patient education? How does the patient see it? Those kinds of things. You're going to have those questions and things that you see in natural practice that have probably at this point raised a whole lot of questions for you, and they're things that have piqued your interest. And one of the first parts of the research process is to sort of say, is from what we're doing to what we should be doing or what we know, is there a knowledge gap? And then we want to think from that, that knowledge gap often comes from, how come if we do this, we get this, but we really wanted this? Or how come we've tried these new tests and they aren't getting us better outcomes? Those kinds of things that you see intuitively in your daily practice of nursing are where the ideas come that can go to those questions. So we're going to identify a knowledge gap basically by formulating a research question. And one of the parts of that is that you're actually searching for existing information that's already there. And you're focusing on that research question as a way to guide you, funnel down, and come up with the literature review that you're going to do for this process. So one of the things to think about is, what's a good research question, right? Because you see lots of things all the time in your practice that could potentially be a good research question or a topic that you're interested in. And here's some sort of ways to think about it before we even start the searching process for the lit review, which will be another video. The first thing you should say is, what's the importance of it? How interesting is it? And is it something we can actually answer by testing it or looking at intervention? And we also have to think about some of the ethical considerations. So is it a protected subject population? Is it something we can actually do? Those kinds of things you need to sort of ask yourself when you're thinking of those questions. Also, you might want to think of what kind of question you're actually asking yourself, or actually you've seen that you want to look at further in research. So is it like a variance question of, is there a difference between this versus this? Is there a correlation between better patient outcome, education, and about a new drug and more compliance? So that's one part, like this variation, if this, then that. And that could be, if you do this intervention, will you get this kind of outcome? Again, independent, dependent. Can we talk about that more later? And some other questions are, is there this that we could change for that? Does having a supportive family mean we have better outcomes for diabetic patients? How much of something is enough? Do we need to do? Then you might want to look at sort of process questions, right? So we've looked at like variation questions, what impacts what parameters determine outcomes. Another type of question that you might have already been asking yourself is how and why things are happening. And that's more like a process question. There's this sort of phrase that we talk about in healthcare innovation, that systems are perfectly designed to get the outcomes that they're getting. So if you want to change that outcome, you have to change something about that system and that system design. And a lot of you probably see and get a lot of research questions from, wow, we're not getting the outcome we want. What is it about this system that we should change? Well, systems are very complex. And if you change one thing, then you'll get a different outcome. But if you change everything, then who knows what was supposed to be changed, right? So that kind of thing is very ripe for research questions that are great for the kind of projects you're doing. So you want to focus on how and why things are happening. And that's a different kind of research question. How is it that we do these processes, but we still get these negative outcomes? How is it that we do training or we ask for people to comply with things and yet we're not getting what we want? So those kinds of questions would mean that you're getting to that research question that you want to look at later, right? And another thing to think about when you're thinking about clinical questions that you might want to use for your research is, what population are you looking at, right? So who's the type of person? Is it an older patient? Is it pediatric patients? Is it adolescent patients? Is it patients who have comorbidities? So that's sort of population, right? And then intervention. What kind of intervention do you think you're going to do? Are you going to change a part of that system if we're looking at process, or are you going to change the duration or the extent when we're looking at the variation questions, right? Another thing is, what kind of outcomes are you going to look for, and what kind of comparisons are you going to do? Are you going to have a control and intervention group? And one thing to keep in mind there, and a lot of times I will talk about ethical issues, is that in medicine, if you're going to have a control and intervention group, the control group, who doesn't get the specific intervention that you're going to do, still has to get sort of the gold standard or the standard of practice, right? So whatever you would do would be above and beyond that. It's not in lieu of, okay? And I think that needs to be really, really strongly stated at this point. Everybody gets the standard of practice that's now. Any intervention or any change that you're going to do is on top of that for an intervention group. So you're looking at your population, what type of person. Then you're looking at what type of intervention you want to do, right? You might also want to think about what, when we talk about interventions, one medicine versus another, one type of education versus another. Is one treatment regimen or education regimen better than the other? When you're talking about comparisons, you're going to compare efficiency of one thing. You could do comparing one, like I talked about before, the standard treatment versus one intervention treatment, an additional treatment, what kind of outcomes you get, okay? Again, it's not super huge. It could be small changes that you're making in the process to get a different outcome. Another thing that you want to think about is, what are the outcomes that you're looking for? Are you looking for a 20% reduction or a 20% increase? And you have to sort of be very specific about what you're trying to get, what kind of outcomes you want to get. Another sort of criteria when you're looking at your research question before you even start your lit review is, are you going to have enough subjects to actually look at this and do this kind of research, this kind of evaluation? If it happens to such a small amount of people, that may not be as feasible for you, especially since you have a shortened amount of time that you're going to be able to do this in. Also look at, do you have enough technical expertise? If you have to ask an entire other floor of nurses to help you with this project or with your subject area, that might be more difficult to actually do. So things to think about. Is it affordable in the sense of time that you need and the time that you have to do it? And is it manageable in scope? So, you might have to do a smaller population over a short amount of time. And again, we can later build on your results, but for now, you have to see, is it manageable and is it affordable in the sense of time and money for you to do as this project? And also, not to be ever underestimated, is it interesting to you? Because I think one of the things that we keep not remembering is this is a long process, and it should be something that you're really interested in, you're really passionate in, or an idea that you really think will make an impact that you've seen in your practice, maybe a certain patient population you work with. So you really want something to sustain your interest, because this is a long process. And the more important it is to you, the more passion you have, the more heart you have in your research, and that's always a good thing.